My name's Chuck Stern. I'm the Vice President of Information Technology at HealthEZ. Been with HealthEZ coming up on 3 years.
My name's Catherine Vanden Plas. I'm our Chief Operating Officer. I've also been at HealthEZ for 3 years, and our relationship with SDS goes back 5+ years.
Can you tell maybe a little more about that relationship, what you know about the relationship, maybe if you know anything how it's maybe started and how it's kind of transformed and kind of morphed into hopefully a strategic partnership?
Mm-hmm. Yes, so SDS has been instrumental in helping us to integrate with a lot of different vendor partners. So in terms of being flexible to meeting client requests and getting data timely, SDS has been a great partner.
For sure. Super responsive whenever we send over a request. Some great ideas that they've offered us. And yeah, it's been a great partner.
Catherine and Chuck, can you talk a little more about the 834 enrollment simplification program that we entered probably a little over a year and a half or so ago, and then what that impact has done not only to HealthEZ, but the impact it's done to your groups and members to make it a very easy and pleasant experience?
Mm-hmm. So the enrollment project has enabled more timely communication with our clients in terms of being responsive around non-compliant data. So it's greatly improved our client experience in getting non-compliant data identified and to the clients quicker so that they can act and make adjustments.
And Chuck, can you talk about how the enrollment program has maybe had hopefully a positive impact on your IT team from a resource allocation or a stress standpoint, or what you thought it was going to do or what it didn't do?
Well, the 834s just in general through SDS have been great because it used to be we used to have an EDI expert on staff to handle it. We would handle the 834s internally. That's all been outsourced now to SDS. We don't have to worry about that, and so we're able to totally outsource that and not have to have that on our plate at all.
And what kind of impact has that made to the customer overall and to you? You might have answered, but just re-asking the question again.
Mm-hmm. Yeah. So we are able to be a better partner to our clients by giving them timely information on the status of their enrollment data, which ultimately then enables their members to get access to care quicker.
Question as well. From your experience, what has your experience with SDS been like overall? I mean, can you talk about the people you've worked with? What's that been like? Is it a pleasant experience? Tell me a little more about working with SDS, vendor or partner type of deal.
Yeah, SDS has been a really good partner for us. We do feel that our partners at SDS genuinely care about us and our business and our growth plans and our success. We've felt that SDS has been collaborative in terms of coming up with potential solutions to some of the pain points that we experience.
Yeah, I totally agree. I think Jeff, our CEO, kind of said it best is he doesn't hear about SDS, and that's a good thing. It's because once things are in place, they just kind of work. And so usually we hear about vendors when they're not fulfilling their promises, and we don't hear much about SDS because they're just working there in the background.
And Catherine and Chuck, if there's one thing you'd tell a prospective TPA, health plan, Blue Cross Blue Shield client about SDS, what would that be? That one thing be that they may not already know?
I think that SDS has a comprehensive product set. So they've been a good partner in terms of being able to provide a lot of different services and value for our organization, and you're continuously innovating. So it's a good partner to have in terms of continuous improvement.
Yep, exactly. I was going to say the product portfolio is really expansive, and obviously in this conference you can just see where technology is important and staying with the latest tech, and then also being highly secure, which is really important in this business. So, yeah, all those things.